Hi guys. Okay, so this is chapter 28. It's going to talk about urinary catheters. Make sure again that you, at the end of this, will go and do your Evolve review questions. Go to Blackboard and look up any YouTube videos that I have posted, um, and also do your skills videos on your Evolve account. Um, Also on NHA, I want you to make sure that you're reviewing Module 1 this week. All right, let's get started. All right, so we're going to do all of these things. We're going to define and some certain terms. Why are we using catheters? We're going to talk about the drainage systems and etc. So let's get started. Okay, so the purposes and types of catheters. Catheters are inserted through the urethra into the bladder, and a urinary catheter drains urine into a drainage bag. This one is a code. Catheter is used when the prostate is enlarged. A suprapubic catheter is inserted through the abdominal wall. A physician would be doing that. And a straight catheter, we use that to drain the bladder and then it's removed. So it would be just temporary. So we would insert it, we would drain the urine, and then we would take it out. And then an indwelling catheter, which is also called retention or Foley catheter, is left in the bladder. This is the one that most often you're going to see, okay? The purpose of catheters, we're going to use them before, during, or after surgery. For people who are too weak or disabled to use the bedpan, urinal, commode, or toilet. To protect wounds and pressure injuries from contact with urine. We also use them to allow hourly urine output measurements, so it's going to be more fine-tuned to be able to measure that. We're going to use it as a last resort for incontinence, so we don't use them like we used to. And if we need to collect like a sterile urine specimen, we would use them, or for measuring residual urine. So we're going to see what's being left in the bladder, okay? When caring for people with the indwelling catheters, the risk of infection is high. That's why we don't like to use them anymore. So a PCT would cleanse the meatal catheter junction at least every 8 hours with soap and water. Again, I want you to watch that skills video. So this is how we would do this, okay? We're going to be cleaning the catheter. So you see here is the meatus, right? So what we want to do is we're going to clean downward. Remember, we're never going to clean upward because that could cause infection. So we're going to clean from this meatus, and we're going to clean downward with one swipe, okay, for at least 4 inches down the catheter, okay? Each time we would be using, if we had to do more, we would be using another section of the cloth or a new cloth, okay? So again, from the meatus down at 4 inches. The drainage system itself, a closed drainage system, is used for that indwelling catheter. Nothing can enter the system from the catheter to the drainage bag. Some people wear a leg bag that attaches to their thigh or their calf when standing up. So if they're out of bed and they're walking the halls, they might have a leg bag attached. The drainage bag is always kept lower than the bladder to prevent urinary tract infections. So if the bag is hung higher than the person's bladder, things would backflow back in and could cause infection. So we always need to make sure that that bag is lower than the bladder, okay? If the drainage system is disconnected accidentally, you're going to tell that nurse right away. Don't touch the ends of the catheter or the tubing. You're going to always practice hand hygiene and put on gloves. Again, you're going to wipe the end of the tube with an antiseptic wipe. Wipe the end of the catheter with another antiseptic wipe. Do not put the ends down. Do not touch the ends after you clean them, okay? And we were going to practice all this in campus lab. You're going to connect the tubing to the catheter, discard the wipes in a biohazard bag, and remove your gloves and practice hand hygiene. Okay? So this is the area we're talking about. So when we learn how to empty this bag, we would cleanse both sites. We never let any of that touch anything else, empty it, and then we recap it. Okay? Leg bags are changed to drainage bags when the person is in bed. And again, I want you to watch the skills video. You're going to open the closed drainage system so it prevents microbes from entering the system. Drainage bags are emptied and urine is measured at the end of every shift when changing from a leg bag to a drainage bag, and when changing from a drainage bag to the leg bag, we also empty it. Also, we're going to empty the bag when it's become full. So make sure that we're watching those skills videos on that. How do we do this? So you see where they've put like a chuck on the floor, right here, the blue chuck. Again, this person has washed their hands, put gloves on, have used the antiseptic wipe to drain if they need to. We're going to put the graduate right under the bag on this blue chuck. The drain of the bag is going to be directly into the chuck, but you do not touch this drain part onto that cup. Okay, keep it suspended in the air. We empty it, we recap it, and then we can go measure the urine. Again, we'll practice this. All right, reset after draining. The clamp is closed and positioned in the holder on the drainage bag. So here's the clamp right here. Okay, so we're going to make sure we clamp that and put this back into the holder, this part, okay, after we've drained it. Okay, so removing indwelling catheters. So you're going to be able to learn how to do that, okay? When the nurse actually puts the catheter in, there is 2 lumens, okay? One has sterile water that we're going to inject through 1 lumen to inflate a balloon. And this helps keep it into the bladder, okay? And then urine will drain out of the other part. So there's 2 tubes, okay? A physician order is needed to remove a catheter. Most people need bladder training at first, especially if they've had it for any length of time, okay? Also, dysuria and urinary frequency are common after we remove that bladder, or after that catheter. So we'll have to be aware of that also. And we will practice on how to take this out. All right, there's also skills video on condom catheters. This is an external catheter, and a condom catheter is a soft sheet that slides over the penis. They are changed daily after perineal care. To apply the catheter, you're going to watch that video. You want to always follow the manufacturer's instructions because they all are different. You thoroughly wash the penis with soap and water. Dry the penis before you apply that catheter again, that condom catheter. Condom catheters are self-adhering or applied with elastic tape. Never use adhesive tape to secure the catheter. Adhesive tape does not expand and blood flow to the penis will be cut off, and that could injure the penis. Okay? Urinary catheters are used to prevent urine flow. True or false? False. All right, that Cood catheter is used when what is enlarged? Do you remember? The prostate. A straight catheter drains the bladder and then is removed. True or false? And that is true. So this one maybe this person isn't emptying their bladder all the way. So we'll put a straight catheter in and empty the rest of it. And that way we can measure to see how much residual is left. Okay? A indwelling catheter, which is called a retention or folding catheter, is left in the bladder. True or false? That's true. Blank is used for routine calf care. We use soap and water to clean that catheter, remember? How often should a PCT cleanse the meatal and catheter junction? Every 8 hours at least. When caring for a person with an indwelling catheter, the risk of infection is low. True or false? You should know this one. False. The drainage bag is always kept blank the bladder to prevent UTI. So do we keep it above, at the level, or below? We want to keep it below so that we don't have any backflow. What would you do if the drainage system becomes disconnected? We're going to tell the nurse immediately. So we wouldn't grab the tubing by its ends and reconnect it. We wouldn't wipe with a washcloth. We would, if anything, we're going to be taking antiseptic wipes and wiping off each side. We would then tell the nurse, okay? Drainage bags are emptied and urine is measured. Select all that apply. So this could be more. Let's see what we came up with. All of them. Okay, so drainage bags are emptied and urine is measured at the end of every shift when changing from a leg bag to a drainage bag, and vice versa when changing from a drainage bag to a leg bag. Also when the bag is full. A Foley catheter has blank near the tip. Do you remember? It's a balloon that we will fill, the nurse will fill with sterile fluid. Once a catheter is removed, a patient can have difficulty urinating. Okay, so that's the end of this one. Make sure again to review all those videos that I put on Blackboard. Go to your Evolve account now and do your review questions, and also check out those skills videos.